My name is Oriana Bodet, as Lois shared, and I am the VP of Innovation at the American Nurses Association. And tonight, we are delighted to have you be a part of the conversation around these incredible nurses who have taken a very different path. And, one of the things about nursing that, when I talk to people is, right, we have one degree and hundreds of job opportunities. And all of us right now are talking about and seeing, kind of the swirl that's happening around nursing and around healthcare. And tonight, we're going to talk about, one of those paths that are open to nursing, where nurses are making incredible impacts, and excited to be able to share the story of these two incredible nurses tonight. So I'm not going to go into a ton of detail as it relates to their bios, because so much about their journey and the work that they're doing actually was an evolution of the work, and the process that they took through nursing as they were navigating next steps. And so, Julia and Shauna, it is incredible to have you here with us tonight, and I'm looking forward to everyone helping me welcome them. So as an icebreaker in the chat, I would love for you, we're going to be talking about a lot of different pieces tonight, but I would love for you in the chat to be able to add your favorite healthcare movie. And if your favorite healthcare movie that focuses on healthcare also includes the CDC in some way, you also get bonus points. We'll be seeing, how many of them we can actually tally, and we'll be sharing some of those with you, as the conversation evolves tonight. So when you think about, what's happening in healthcare, we are seeing different parts of the healthcare system to some extent that have collapsed essentially over the course of the pandemic. We're seeing, the non-essential jobs vanishing. We're seeing life expectancy globally drop. We have seen unthinkable changes across society and healthcare, and altogether this has been a collective shock to people across the globe. We're hearing a lot about nursing shortages, and the voluntary exodus of nurses from across the profession. And, again, part of this is we want to be able to make sure that nurses know that it's okay to take a break. It's okay to take care of yourself. And it's okay to, start to look at what some of those other possibilities might be for nurses, and how nurses are impacting care globally, nationally, and in these on these paths that, again, may not receive all of the attention in just everyday conversation. There is this quote, and it is by Hale, and he said, growth is painful, change is painful, but nothing is as painful as staying stuck where you don't belong. And so really encouraging ourselves and each other to find those paths, to follow your passion, to start looking at other things that fill our bucket. So curious what your thoughts are in this space. Are you in a position where you are, working in a non-traditional role? Do you have interest in areas, or are you doing work? Are you volunteering and doing work outside of traditional roles? Would love to hear about it in the chat. I thought this quote was beautiful. The only way to make sense out of change is to plunge into it, move with it, and to join the dance. And these two incredible nurses who are here with us tonight joined the dance, right? They took a different path, and they have been creating solutions and innovating nationally and globally, and bringing their nursing knowledge to broader and broader conversations. Because, again, their journey is so important to the conversation. Tonight, I just want to introduce them by title. And on the right, I would like you to meet Julia Petrus. She is an epidemic intelligence officer at the CDC, a bacterial special pathogen, working in the bacterial special pathogens branch, and also Dr. Shauna Miko, who is featured on the left. She is also an epidemic intelligence officer. She is focusing, her branch is domestic water, sanitation, hygiene, epidemiology team, Waterborne Disease Prevention Branch, and also the Division of Foodborne, Waterborne, and Environmental Diseases at the CDC. So thank you both for being here with us tonight. So when we were prepping for this conversation and our, the lounge tonight, Shauna actually shared some of the books that have been shared with, that she has been collecting as she's begun this work, where the work of the Epidemic Intelligence Service has been highlighted. And I don't know if any of you have shared any of these or read any of these books or had exposure, but Shauna, she called them Fame or Glory, as she was highlighting. And I'm looking forward to getting her feedback around the books and some of the movies highlighted here that she shared with us. And curious if, I know I have seen let's see, I've seen 4 out of 5 of these, and I'm sure you have too. And I was teasingly telling her that, I think about if you've seen World War Z with Brad Pitt, I'm like, Shauna and Julia are working in the roles where they are going to fly the helicopter to their house to come and pick them up to help figure out how to solve these emerging issues around the country and nationally and internationally. We also want to make sure that as a part of this conversation, and we'll be sharing links tonight with all of you, that you have the information about the EIS program, the fellowships at the CDC. So we'll be dropping all of these into the conversation as we move forward. And just a quick reminder to all of you nurses who are interested in innovation, interested in, who are creative, you're doing great work around the country and internationally. A couple of great funding opportunities. Right now, Nurse Pitch is open. We're looking for those 3-minute videos. Again, cash prizes for those nurses who are submitting. So again, a unique funding opportunity. This one is actually a virtual nurse pitch, and then the Innovation Award, which opens on June 1st. So thinking about innovation, this quote from Orrin Heron, "The electric light did not come from the continuous improvement of candles," and how critical the work that we are doing as nurses to innovate, to lead, to create solutions for people and communities and families, and how we are doing this work every single day. And when we think about all of the uncertainty that's happening across healthcare, we tend to lean into process improvement, but so much of what we do and what's so critical in this space is the creativity that we bring and our ability to think through and find unique solutions across healthcare. And you're going to hear that from these 2 incredible nurses tonight. If you have any questions, things you want to work through in the innovation space, please don't hesitate to reach out, contact myself or Lois. When we think about the work of the profession, the next decade is going to be probably one of the most significant moments for us and within the, when we look at the opportunities to transform society, we all have a part to play in creating, what the future looks like. Innovation is not a zero-sum game. There are no shortages of areas to be transformed across healthcare. And our goal is to grow this innovation community because when nurses lead, everyone wins. So tonight, I am ecstatic to be able to share and introduce, share these conversations and to introduce Shauna and Julia with you both. So Shauna, are you willing to introduce yourself first, and then Julia will go to you next?
Absolutely. Thank you so much for having me, Ori and Lois. Really appreciate it. And it's an honor to get to speak with other nurses this evening. So I'm Shauna Miko, and I was a bedside nurse for about 15 years, I'd say. And I worked in pediatric cardiac intensive care, so cardiothoracic surgery and heart-lung transplants, very one-on-one intensive critical care. And I really enjoyed it. Somewhere along the way, I realized how much I really enjoyed also teaching family members and caregivers and helping them prepare to take their children home and take care of their critically ill children. and support them neurodevelopmentally and physically. And so I went back to school for my MSN in education and to help me continue to teach family members. And then that turned into also teaching nursing students. And at the time, I still didn't know that I was in love with public health. It was a secret to me. And I was teaching pathophysiology and pharm and, critical care and A&P and all these things that in my brain I thought were these very easy, hard sciences, very black and white, matter of fact. And one semester I was asked to substitute for our public health instructor who was leaving the program. And it was my first taste of teaching public health, of learning about public health, of learning about the nursing role in public health. And I don't know, I was overwhelmed with this new sense of it's almost this sort of dichotomy of I know what I want to do and I have no idea what I want to do, but I know I want to do public health. And so with that, I started finding ways to work in public health while still working in education and critical care, and then eventually returning to school. I thought that was the best way for me to continue my journey, of which I still was not clear on where my journey was taking me or where my path was leading. But I thought that returning to school for my terminal degree in nursing and a master's in public health would at least open up some avenues and give me ideas. And so I was very fortunate, and I found a dual degree program where I earned a doctorate in health innovation and leadership and a master's in public health at the University of Minnesota. And it really did open up doors for me. It was there that I was able to apply for a fellowship with the Center for Global Health and Social Responsibility. And I was awarded this inaugural scholarship and the first nurse ever to be in one of these fellowships at the Center of Global Health. I was the Scholar for Population and Refugee Health, and I relocated overseas to Uganda and worked from there, based in Kampala, but traveled to other sites where the International Org for Migration, or the IOM, which was a learning curve because the IOM for a lot of us is medicine, but the IOM now in my world is International Org for Migration. And so I worked with the IOM and CDC and traveled to their various sites where they had transit centers for refugee health, refugee processing, and where people are seen before they migrate. And I worked over there for quite some time on several projects. One was building nursing capacity for the nurses who come in to those roles with various educational backgrounds. So we were trying to build nurse autonomy, increase their scope of practice and their ability with continuing education and standard operating procedures. And then another project was working with the health and hygiene promoters on teaching just some standard wellness and health practices for resettling migrant populations to help keep them as healthy as possible and familiarize them with the journey that they were about to embark upon until they received additional education from resettlement organizations. And then the pandemic hit, and everything changed. We were still successful with those projects, but I was thinking about what next. And some friends had suggested the EIS, Epidemic Intelligence Service. And I hadn't thought about being an epidemiologist prior to that, but as I looked into it, it just made more sense. I felt like I was already doing a lot of that job as a nurse, but there were still a lot of significant skill sets that I could get from being an epidemiologist that in my brain made me like the Wonder Woman of public health. And so I applied, and again, was very honored and fortunate enough to be accepted. And here I am, living my dream.
Thank you, Shauna. And, I'm curious, we'll be, again, for the audience, just to remember, if you have questions that pop up along the way, we will be weaving back to those questions. So if you're thinking of anything while our speakers are sharing their stories, don't hesitate to pop those into the chat. And Julie, we would love to hear your story as well.
Sure. Thank you so much for having me. I'm really excited to be here with Shauna and to share our experiences. So my story is definitely not the traditional route. I've been so fortunate in my journey as a nurse. I've been a nurse now for 9 years. I went to nursing school at the University of Vermont. I'm in Burlington. And, I think I was a little unclear, honestly, when I first started nursing, kind of what the profession was all about. It was kind of a mystery to me, but I knew I wanted to work with people and that I loved science. I also knew that I was attracted to population level health. I didn't know what that really meant, but I had a feeling like some kind of core drive to seek that out. So I got an opportunity in my undergraduate time at UVM to travel to Bangladesh for a public health clinical that I had. And it was there that my eyes were opened to this world of international public health. And it was actually 2 years later, once I graduated nursing school, I worked in home care for a while, got clinical skills under my belt. And then I was invited actually back to Bangladesh to teach at a nursing college that was one of the only bachelor level nursing schools in the country at the time, which was an amazing opportunity. I got to assist in curriculum development and led clinical rotations at a mental health hospital. We did a lot of community public health work, setting up screening, and then also, lecturing the various core nursing classes for the nursing students. That was a great opportunity for me. And after that, I actually returned back to the States and went into cardiac nursing. So I worked on the telemetry unit at the University of Vermont Medical Center for a while and got some of those acute care nursing skills under my belt. Enough so that I could start travel nursing because that was kind of a dream of mine. And so I started doing some travel nursing, which took me from Vermont to California. And that's when after some time with doing that, this public health bug kept coming back into my head. And I took some continuing ed classes on epidemiology, and I thought, this is interesting. Long story short, it was actually while I was in Bangladesh teaching that I was working with some nurses there that said, hey, I did this tropical diploma in tropical nursing at the Liverpool School of Tropical Medicine. It was really awesome. You should do it. So I remembered them telling me that. So sure enough, I land myself in Liverpool and I complete a professional diploma of tropical nursing, which was amazing. It was kind of the perfect combination of all of my interests at the time. Fascinating, learning from snake bites to parasites to, malaria, really exciting subject matter. And then I actually moved right after that back to Bangladesh, where I was working with Medical Teams International. It's actually a domestic based NGO that was working in 2017 with the Rohingya refugees in the south of Bangladesh. So I assisted them in helping establish primary care centers there and building up their community health worker program amidst a pretty large diphtheria outbreak. And it was there that I saw my first glimpse of my dream job, which was a WHO epidemiologist who was leading this diphtheria outbreak. And I thought, I want to be her. And it was actually during this time I was working with a physician who said, hey, I just got into EIS. You should really consider it. So once again, another mentor popping in. And then I went back to school. I went back to the Liverpool School of Tropical Medicine. I got my master's of science in international public health. And that eventually led me to EIS. And in between that, I did do some pandemic work running COVID vaccine clinics in California right before joining and working with people experiencing homelessness in Santa Barbara County and leading some research in that area. So anyway, that was a very convoluted path, but that's my path. And I'm very, very proud to be a nurse, and I'm proud of the journey that this career has allowed me to go on.
Well, Julia, thank you. Thank you for sharing that. And, one of the things that we just popped into the chat is your LinkedIn bio. So if people want to follow you on LinkedIn and follow the work that you're doing, we shared those in the chat, along with information about the EIS program, applying to EIS if this is something that you're interested in, and the other fellowships. And so just for the audience to know that that's residing in the chat if you have other interest. So I'm curious, with both of you, taking these, what some people would consider non-traditional paths, are, in reflection, kind of looking at the work that you've done. Do you feel like you're where you're supposed to be?
Shauna, maybe I'll chime in. That was, yes, for me, overwhelming. Yes, I feel exactly where I'm supposed to be.
I agree. It is, similar to Julia, I couldn't have written that story of my journey up until now, and I couldn't have planned 5 or 10 or 15 or 20 years ago where I would be right now. But I love the work that I do. And one of the things I was concerned about when I even remember back when I went back for education, I was challenging myself to still say, or even if you leave the bedside and you're a teacher, you're still a nurse. Or even if you leave the bedside and you go into EIS or CDC, you're still a nurse. Like, I had to continually remind myself that I'm still a nurse. And then it was just talk. But as I've entered each phase of this journey, I'm able to find myself say, oh yeah, I am definitely still a nurse. And that's a testament to what we do as nurses. So I'm thrilled to be where I am. I'm thrilled with the work I'm doing. And I'm even more thrilled to still know that what I'm doing is nursing as well.
So both of you, when you think about, the work that you're doing at the CDC, what do nurses and the people who are on the phone call, what do they need to know about EIS and the EIS program?
It's competitive. It is, it's a very challenging program, but it's incredibly rewarding. So it's not too all unfamiliar with, I'm sure, a lot of the nurses here. There are nurses in the program each year. However, out of a class, less than 10% are nurses. However, when you're in the class and when you are matriculating, with colleagues in these environments, it never comes up that, oh, you're a nurse, so maybe you're not at this level or anything like that. As a matter of fact, I think a lot of times the nurses are maybe secretly more highly regarded than maybe some of the medical professionals in some instances, just because of the clinical skills that we often come with. And I think, Julia, you had some additional info, right?
Yeah, I just wanted to say, for those who aren't familiar with what EIS is, it stands for Epidemic Intelligence Service. It's a 2-year training fellowship, and it's really focused on applied field epidemiology, which makes, that for me is the most exciting part of the work, is that you get to go out in the field and actually be a disease detective and figure out the source of outbreaks. It's the coolest job ever, I think. And so it's a training fellowship. So you are working, you're employed by CDC, but you are a fellow still, and you get mentorship, and you have a supervisor. In fact, you usually have two at least, primary and a secondary supervisor. The application process, I think every year it cycles, I think in May is when applications are due. And if you don't get in the first time, I encourage everybody to keep trying if that's really what you want. You know, it is competitive, but you know, there's plenty of nurses who have made it. And I think I second what you said, Shauna, about, you know, I was a little nervous coming into it because I thought maybe I was the underdog as a nurse, because there's a lot of physicians, there's a lot of PhD level epidemiologists that are also your peers in EIS. And I quickly realized that we as nurses bring some really unique lens to the job that I think, you know, is really valuable. And so we can talk about that more later, but I do encourage everyone to apply. And the minimum requirement, I just refreshed my memory. You have to have a Bachelor of Science in Nursing. You have to have an active US RN license. And it says strongly encourage, and I think this is true, strongly encourage to have a Master's of Public Health or some similar degree, or a year, at least a year of public health experience.
Well, there was a, you know, when you think about the experience and you know, you talked about it, right? Innovation is so much about trying, failing forward, trying again. It's that iterative process. You know, both of you in our conversations and prepping for this, you know, talked about how you're navigating the work that you're leading in this space. And great conversation, great question that popped up in the chat around, you know, when you think about your own journeys and that, so this is from Dr. Peshet, you know, what shifted your perspective and framing from, you know, local to global, and the, you know, how did your view of nursing change? And perceptions around what the nursing role is in that space.
I can start with that. It's hard for me to pinpoint exactly, but for me, at least in the international space, the role that I've had and the big role that I see for nurses internationally is capacity building for other nurses, and that role of being the educator. And that's kind of my experience. But for me, looking like from the individual to the global, I'm not sure where that curiosity came from. For me, it was, I think maybe an early experience that I had, like in high school, traveling to Thailand, working or volunteering at this orphanage on the Myanmar border with refugee children who at the time could not access healthcare as their Thai neighbors. And I think that got me starting to thinking about health disparities and refugee health, and looking past individual health. And I think that's kind of an early experience that kind of triggered my curiosity. But apologies if I'm not directly
No,
answering
yeah,
that question.
no, I think it's good. You're right. And I mean, part of it, you know, you talked about in your work, you know, I think that capacity building, the education, sharing what you're doing, influence, right? Your ability to influence more broadly. You know, during your openers, you talked about how nursing is viewed across the EIS teams, and the respect that you know, that those team members have for you because you are nurses in this work. And curious, you know, why, when you think about, you know, why are nurses suited? So, you know, why are both of you so strongly suited, and why are nurses respected more in this space? What do you think it is about nursing and you know, being successful and in this work?
I think we discussed this a little bit, just the idea of how nurses in our everyday work, wherever it is, whether it's, bedside in a hospital or in a clinic or home nursing, wherever it is that we work, I feel like we are always asked to do some more than what we have resources for, more than what we have time for, more than maybe what people think we do. I think that nursing is incredibly difficult to define because there's not too many limits to what it is that we do in a matter of a shift or a week or a career. And that takes a lot of flexibility. It takes a lot of intention. It takes a lot of compassion and patience. It takes a lot of sacrifice. And it takes the ability to start. For example, I was, in an ICU. And so I definitely had a lot of algorithms to work with to support my care of my patients and weaning and titrating. But things don't always go according to the algorithm. And sometimes you have to adjust and you have to be flexible and you have to create your own new algorithm in the middle of the other algorithm. And I think that practice, along with communication and the understanding that some people envision that there's a hierarchy that may not exist when we're all, there for the same goal. I think those things have been invaluable in the work that we do. I can't say much more than that.
I'll just
So,
add, oh, go
please
ahead.
go ahead.
I was just going to add, I think the ability as a nurse to develop rapport with patients, with whoever you're working with, really, really quickly, especially with people in their most vulnerable moments. I think that is such an amazing skill that's quite unique to our profession that I think is directly translatable to and into a career in public health, into what we're doing now. I think that those skills, those kind of softer skills, I think are really, really strong for nurses.
And, both of you highlighted these moments of transition, of change, of crisis, of pressure. Why is, thinking about adaptability in those moments and adaptability in moments of crisis. And I know that both of you are navigating lots of, broad scale work nationally. And I was so impressed by some of this, the stories and experiences that you shared. But I think the group as a whole, to be able to put into context, understanding, what is EIS, that you are nurses in this space, but what are some of those things and bodies of work that you can share with the audience today?
Do you want me to go first, Julia? We have so much to talk about. It's been a busy year. I think early on in the start of EIS, it happened to coincide with the evacuation of the Afghan people. And the United States accepted over 100,000 Afghan nationals during that time. And typically when a refugee, a migrant, an immigrant is going to another country, resettling, they go through the process of medical clearance and health checks, and medication, treatment, education, vaccinations, the ability to have medical records. They know what city they're going to. They're connected with a resettlement agency. They have somebody to meet them whenever they arrive and help sort of support them through those first several months of resettlement. And this was an exception to that. And we found ourselves having to support in this massive interagency effort, the health and well-being of these people who had emergently left their home, with, of course, very few of them were able to have medical records on hand or identification or their personal belongings. Many people were separated from loved ones. So this was a massive interagency response called Operation Allies Welcome. And the CDC and the Epidemic Intelligence Service was called upon to help support the public health and well-being of each of these sites where these populations were temporarily housed. And that required a host of activities, from basic water, sanitation, and hygiene assessments to supporting recommendations for the healthcare providers that were on site to do surveillance and screening, just for infectious diseases or even traditional illnesses of children, watching out for pregnant mothers, etc. And I think that many people are familiar through the news that there were several cases, a handful, a couple dozen cases of measles among the population that slowed down the resettlement process and gave us all time to coordinate and work with all these agencies in standing up all these mass vaccination campaigns, which was an incredible coordinated effort where we vaccinated hundreds of thousands of people for measles, mumps, rubella, COVID, got medical records together. We're able to process people through the proper channels, get them identification, get them registered in the system, everything that they traditionally would have had overseas, get this done on these different sites. And our team, Epidemic Intelligence Service, the EIS officers were instrumental, and we were stationed at these sites to help support and provide recommendations. And with our help and the wonderful efforts of all of these other agencies, the Department of Defense and the Uniformed Services, working together and coordinating those efforts, we were able to take care of this population and also protect the population of the areas, the communities of which they were going to resettle. And I think that that was probably one of the larger examples that we've been working on, and that was a really big success that required just multi levels of public health and nursing.
All right. Well, thanks, Shauna. I also had the privilege of working on that response in Virginia in October, and it was an amazing opportunity to work with refugee population, but this time in a domestic setting. I think I'll just say my one highlight from that experience was working with the Afghan refugee group that were physicians over in Afghanistan, who were amazing partners in rolling out this mass vaccination effort and trying to protect as many people as possible from certain infectious diseases. So I just wanted to share that. It was a great experience. For myself, I've been quite lucky in that the first day of EIS, I landed myself in the middle of a investigation involving this tropical disease called melioidosis, which is a rare tropical condition mostly seen in South Asia, Northern Australia, South America, caused by this bacteria, Burkholderia pseudomallei. So I was thrust into this investigation day one, and had to learn very quickly everything I could about melioidosis. Of course, I had my subject matter experts at my shoulder helping me along the way. But essentially, there were these 4 mystery cases of in 4 different states, 2 children, 2 adults, 2 had passed away, unfortunately, of melioidosis, 2 survived. And they popped up in like a 5-month time span. And none of them had traveled to an endemic country. So it was a complete mystery. And we were working around the clock to investigate and try to figure out what was the source of their infection. And after months of work with our lab partners and our state health department partners, and I traveled to the house of one of the patients and had to interview and the family with the health department and sample hundreds of products under the sun, take soil samples, you name it. We eventually found the source in the Georgia patient's home. It was a aromatherapy spray sold by Walmart to about 4,000 households in the US. And it was quite an amazing experience, very, very sad situation and circumstance. And that's kind of where I think I tapped into that nurse part of me. In that house, going to the family that had just lost their child from this disease, and having to like walk that line of getting the investigation, getting the things we need to get done with the investigation, then being sensitive and building that rapport. I mean, that all was a balance, and all of that, definitely I was tapping into my nursing brain. But I think for that outbreak investigation for me, I'll remember forever, and we're still working on it. So I've been quite busy with that particular investigation.
And I'm curious, just even in the chat, if anybody on the call it was aware of the room spray, and one of the pieces of solving that mystery, right, and the ability and skills of nurses to understand the levels of care that how people navigate spaces, how they commune with others, and you talked about your leaning into that nursing space and leaning into your nursing knowledge. Are there other moments where your nursing has pulled you through in some of the work that you're leading and working on?
I think there's a lot of examples, and some that I probably wouldn't even be able to recall because it's just so innate. But going back to what Julia and I did working with OAW with that response, beyond making sure that the logistics were there for quarantine and isolation and mass vaccination and things of that nature, there was also a lot of holistic work that needed to be done. When somebody maybe had symptoms of measles or had symptoms of COVID or something like that, and traditionally you want to quarantine or isolate that person, we also had to be completely culturally aware and sensitive that you may not be able to take a mother away from her family and isolate her or quarantine. So we needed to think about how we could support these family values and these cultural values and still protect the rest of the health of that population on site. Food, making sure, there was a great deal of effort that went into serving food to the populations, and they tried very hard to make sure it was culturally appropriate, but there weren't always translated or translators available to talk about what was in the food. And for cultural reasons, a lot of people maybe didn't want to eat the food because they didn't know the ingredients. Thinking about having recreational spaces or spaces of worship in these sites, thinking about hygiene and privacy. lots of different things that we deal with as nurses in the care of a single person, you know, their modesty, their culture, their emotions, where they are. A lot of that had to be addressed, and we had to plan for that in this response. So beyond this mass vax campaign, we were making recommendations to pull in psychologists and therapists with translators so that these families could debrief the trauma that they just went through evacuating from their home country. We wanted to make sure that they were able to worship the way that they wanted and have access to potable water for cleaning and ablution. Just a lot of things like that that were very nursing, that maybe some of our wonderful, really amazing, strong counterparts in the different agencies and uniform services maybe hadn't prioritized necessarily yet, because, you know, it was a mass evacuation. We're prioritizing just health and safety. But at a certain point, you know, we also needed to raise these issues up as priorities as well.
So a couple of good questions have emerged through the chat, and you know, you're talking about, right, the holistic lens that nurses bring to solving problems, and you know, as you were navigating that space. But both of you have also, you know, had to come up with, you know, solutions on the fly. You're creating, you're connecting, you're convening, all of those things that nurses do so well. But, you know, you're also, you know, through that process of creating, you're, you know, creating innovative new solutions. Question in the chat around, you know, what innovative principles and practices do you think, you know, have you gleaned over time, and how do you lean into that innovation space in your work?
I was going to give Julia 2 more seconds to take that one. This is something that we've been talking about offline a little bit, and I have a degree in health innovation, but in my mind, I sometimes think that innovation is just this unique, fancy buzzword for, you know, the ability to stay with something and make a mistake and learn from it and listen to people and adjust and work together. It's the word for the process of just making sure things are right, or making sure things are what they need to be to support your mission. And so it's a difficult question for me to answer, because in my mind as a nurse, I can't think of any other way to be than to go back and check what I've done, and to make sure that, you know, what I've done is the right thing, or could it be better, or do we need to make changes in a plan of care, no matter how small or large that plan of care is. You know, what additional things need to be done? Is this good for short term or long term? And where do I need to go in the future? What do I need to think about? I think Dr. Peshet is in the audience. Foresight, foresight, you know, just planning and preparing for that future. It's not an intervention and walk away. But as nurses, I don't think we've ever been that way. So it's hard for me to separate, you know, what some people say is innovation versus nursing.
Mm-hmm.
It's what we do.
How about you, Julia?
Yeah, I think what comes to mind for me is, you know, one, I think innovation too kind of speaks to application of knowledge, you know, to reality, right? So like being able to, as simple as it sounds, you know, you can have this great idea and it can be backed with all the science you want, and it can sound really good, and you can have everybody sign off of it, on it. And then it's all about, for me, the application. Is there buy-in? Do people understand it? Is it effective? Does it make sense? Is it sustainable? For me, that's kind of what I think about when I think about innovation and what has worked in some areas of the work I've been a part of. And then of course, not reinventing the wheel. For me at CDC, that's a big one that I've always been told by my mentors. I think for me, I think initially the word innovation, like, oh, you have to create the wheel, but I don't think that's true. I think you can reinvent the wheel. You can mold something. You can learn from history and mold it and apply it to your current challenge.
Mhm. Yeah, and it's interesting hearing both of you kind of lean into that space. And we know that there is a one-to-one correlation between innovation and the design process. So where we in nursing, we talk about, doing that assessment, right? And then in design, we talk about empathy. And when we're, and so when we think about that correlation and kind of moving through this process, iterating, finding solutions, where do we intervene? How are we evaluating? How are we testing? And Julie, you really are leaning into, I love that, the science, right? What else do we know that we don't have to recreate things? How can we build upon, the incredible work of others to keep advancing healthcare, keep advancing nursing and the care that we're providing, and that process of iterating and going and evaluating and going back and forth is the nursing process. It is the design process. It is how we lean into creating new work and innovation. So whether that's an improvement on something existing or something new, because maybe you are, for the first time, you are creating a brand new wheel. But so many of the innovations that we see are right. It's this improvement. It's building. It's growing on things that are already there. And so when we think about that work, a great question from Mary, who is in the chat, Mary Tanner, talked about her role in this space, faculty, service learning, and that question came up. How do we get, and also Dr. Peshet commented on it. How do we get this nursing educators? How do we raise the awareness of the breadth of work that you're leading as nurses? How do we get this kind of information into nursing curriculum? What do you think needs to be in that space? And this could be promoting, to promote this, more global awareness. Maybe it's fostering innovation or leadership, for nurses moving forward.
I think just speaking from my experience, like that opportunity that I had in my undergraduate nursing education to go to Bangladesh and work in, have this public health clinical, that opened the world to me. I think it's so important to have those opportunities embedded in nursing curriculum. And of course, acute care nursing and all of that is very important to learn in nursing school, but we should not forget about instilling this idea early in nursing, when you're going through nursing education, that there are so many different avenues for a nurse. It's not just bedside nursing. And I think, I don't know, maybe I hope that's changed since I was in nursing school. But I know for myself, that early glimpse into global health through that experience was really, really important for me. And I'm not sure if I didn't have that, I really don't know where I would have been today.
I have a similar answer, just really being able to be exposed to that. I used to have this medical mentor in cardiology, and he, very beloved to me, he used to say that he had a medical school professor that told them one day, half of what I'm teaching you is wrong. But the problem is I don't know which half yet. And I think that speaks to, what you're learning at that time. As we evolve, as we continue to learn more about people and science and medicine and nursing, those things change, recommendations change, beliefs that we have about care can change. And so I think being open to knowing that what we're learning can evolve and can change, and not always, being certain that this is how you inflate a Foley before you insert it in, or this is how you have to use, whatever Coban for taping IVs, and things can change. And so, what I learned, the model of care that I learned in nursing school was what I learned. And it was having those experiences like traveling to Cuba, for example, and learning from consultorios and that community-based medicine that helped me realize that things can change, models of care can change. What I'm learning, or what I had learned, is not the end all be all. It's not the primary way. It's not the best way necessarily. And we can change to provide better care and take care of one another.
And I just want to say one thing, I think, which triggered something. I think it's also, for me too, the amount that I've learned and been able to innovate and bring back to my practice in domestically or in other areas that I've worked. I've learned from people in these international settings that had very limited resources. The amount that I've learned from them, it's like it's a two-way street. I think innovation is a two-way street in that way. So I just wanted to say that and recognize that, because that exchange of ideas, I think, is what makes this such an interesting experience.
Just a comment, being open to learning throughout nursing, the nursing journey, right? That it is that learning mindset that we are. I think about, that quote from Nightingale: "Let us never consider ourselves finished," and just that it is this process of growth. As we continue to push ourselves to provide the care and that the communities and people that we're caring for need, and what is that back and forth and that interplay between, the knowledge that you're gleaning from other areas. And both of you have, again, with your education, are there any, Julia, with your tropical medicine background, both of you have a background in public health, Shauna, with your experience in health innovation leadership, was there anything specific from those programs that, has been invaluable as you're moving forward?
I take with me every single bit on this journey that I am, and every professor that I've had, and their words of wisdom and their experience, and my classmates. Like I couldn't necessarily call out one thing, but particularly in the health innovation and leadership degree, I learned surprisingly a lot about leadership. It's not flashy. It's not standing at the top of a pyramid. It's not persuading followers. It really is partnership. It's collaborative. It's strength and sensitivity. It's a lot of things that I really didn't know about, even though I was a charge nurse for a really long time. So that was wonderful to be able to take that with me and inform how I communicate with people. And I'm sorry to continue to go back to the OAW, the Operation Allies Welcome, but I feel like that was such a wonderful experience to kick off my EIS journey. And so when you are deployed to the sites, you are the representative for the Center for Disease Control. And I am, for all intents and purposes, 1 month old of an EIS officer representing our institution at a table full of colonels and generals and the Department of State and ICE and Homeland Security. And they listen to you. And when you're trying to ask for concessions, when you're trying to ask for additional things from people that envision something a certain way, realizing that leadership is about making sure that you're collaborating, you're being clear with your intentions, you're honoring the people that you're representing and working with, and to move that forward to a shared goal, I think is something that was really helpful for me that I have learned in my particular program. Maybe a little muddled of an answer, I apologize.
Not muddled at all. Julie, anything from you from tropical medicine?
Yeah, well, as you couldn't guess, I'm here with the bacterial special pathogens branch, and melioidosis, like I mentioned, is a tropical disease. So I feel a little bit at home in that, this tropical nursing diploma that I received from the Liverpool School of Tropical Medicine, it gave me a foundation in a whole spectrum of tropical diseases, from neglected tropical diseases to snake bite to parasitic disease. And I think that definitely has helped me have a framework for this work that I'm doing now. Also, my master's of international public health, my research was in Uganda. I was managing and coordinating and designing this household survey looking at a whole spectrum of maternal and child health indicators, from childhood vaccination coverage to malaria prevention during pregnancy. We were comparing the refugee population that is, that came from South Sudan into Uganda. We were comparing those indicators in the settlements, the refugee settlements, to the host community and seeing if there was disparities. So all of this training was so experiential that it's hard to nail down exactly what A led to B, but I mean, these experiences were amazing, and I definitely think that they've helped me be able to work with multiple different sectors, talk to multiple different types of people in different lanes, like Shauna alluded to, like with OAW, being able to navigate very complicated issues and solve problems on the spot. Definitely that training definitely, translated into that for me.
A couple of comments in the chat. So Jerry Milstead, he commented on, especially with the, just kind of nursing education as a whole, its focus in acute care, but with the pandemic, really the importance of public health, global health, health policy, and the role of innovation being integrated with, these pragmatic activities, right? You were pushing yourselves into spaces that were uncertain, right? And in that uncertainty, we have to grow. When we're trying new things, we're learning new things. And both of you exemplify how not only did you leaned into the dance, right? You leaned into that space, but and how that all of those different experiences cumulatively have developed you to be able to do this work. There is Julie is in the mentioned in the chat as well. She is a BSN new grad, very interested in this space, and she's curious about that she wasn't getting a lot of this in school, but what do you both see as the opportunities for promoting health capacity in communities, the roles of for nurses in this space, maybe nursing students who are interested in this space? What advice do you have for them? And as we look at the transition and the changes in healthcare from acute care settings more into the community, what do you guys see as you're looking at this through your national and global lenses, and how can you help nurses who are interested understand maybe what might be next for them to be able to pursue this?
I will just provide a short answer because I know Julia's going to have some really fantastic ideas. One of the things that I would encourage you to do would be to engage with your local or state health department or tribal or territory health department. The amount of work that is being done with the resources, with the human resources, it's just stunning what local and state and tribal and territorial health departments are tasked with and what they accomplish. And this is everything from your food that you eat in a restaurant, to the water, to your swimming pools, to your soil, your environment. Everything starts and ends with that state and local health department. So many of them hire nurses for various capacities, or you can even engage for a small part-time position if you're trying to get in the foot into the door. There's also additional fellowships that are not epidemiology through the CDC. I think Ori put the link in the chat for nurses that would like to do a fellowship in public health with the CDC. Engaging, I mean, there's so many opportunities, but there's also some difficult choices to make because nobody goes into public health to get rich. So I do want to respect that, you know, there has to be some sort of planning and choices made whenever selecting those opportunities. But Julia, I'm sure you have some ideas too.
Yeah, I'll just add, yeah, definitely, you know, the role of the public health nurse is, I think, a bit different state by state. I myself worked in California. I got my public health nursing license in addition to the RN. I never worked with for the health department, but I worked actually for a private hospital that happened to have a population health department. That's actually where I was working with people experiencing homelessness and doing street medicine. So you'd be surprised. Like, I did not expect to find that opportunity in this smaller town, but it existed. And that was pretty awesome public health experience, working not for the government, but for a private hospital that was really, really wanting to change, make positive change in their community. Another thing that comes to mind, it's never, if you're able to do it, and of course, you know, finances always seem to get in the way, but if you're able even to do like a short, if you're a new grad and you want to do international work, always good idea to get involved with an NGO, Doctors Without Borders or Medical Teams International. That's who I went for with Bangladesh. There's a lot of volunteer-based organizations that love to have nurses, need nurses, and some are a little easier to get than others, but once you get your foot in the door, things will open up from there. And then the other thing, I just wanted to say too, you know, public health nurses are so important, and I'm hopeful that with the pandemic and the way things are shifting, I would love to see more public health nurses in infrastructure, more jobs for nurses in this area. I don't know if that will happen, but that's my hope. I got to work with some fantastic public health nurses during the Operations Allies Welcome with Afghan refugees in Virginia. I got to work with public health nurses during the melioidosis investigation in Georgia. So they're out there, they're doing amazing work. And I think that's definitely an avenue worth exploring if you are at all interested in public health.
Thank you, ladies, so much. This has been so valuable. You know, it all started with public health nursing, kind of, right? Didn't it? It's kind of going full circle. I am a home health nurse. I'm an acute care nurse of 30 years and a home health nurse for 6 years now. We have been trying desperately to work with, and I'm in Maryland, work with the schools of nursing to integrate more home health nursing into the curriculum. And it's, again, home health nursing is very much public health nursing based, because where does it all happen? It happens, health and wellness happens where we live, where we spend 90+% of our time. So questions to you all, and you may not have the answer, but I think this is a good forum to ask. How do we push the innovation to include this public health nursing, home health nursing, community-based nursing into the nursing curriculum? Because as you know, a couple of us have mentioned, it's not in the curriculum, and the nursing curriculum is NCLEX based, and it's the 4 NCLEX tiers that we are being, not we, I'm long past it, but you know, that our nursing students are being pushed into these directions that do not include public health. So, you know, it's going to depend on somebody's passion, and maybe getting a spark somewhere, like the two of you did, or I did. You know, I ended up, after 20 some years, going back and getting a master's in, well, getting my BSN, and then getting my master's in population-based care coordination, which is very similar. You know, I really feel like I have a public health focus. So how do we do that? How do we, as innovators, as an amazing innovators that we are, how do we get that moving forward for our profession?
So Pat, thank you so much. You know, Shauna and Julie, I'm happy to take a poll at that, but also, you know, if you have any thoughts, feel free to jump in there too.
Go ahead, Ori. I just wanted to encourage Pat to apply for EIS, because not all of what we do is, you know, acute infectious disease detectives. We have an entire center dedicated to equity and minority health. We have chronic disease. We have maternal child. We have a lot of centers. So come our way and bring that change, like seed with you, please. But yes, I know Ori's got some responses to this one.
You know, Pat, I think you're right. But you know, one of the things that, you know, as nurses in this space, nurses who are interested in this space, so much is changing. You know, right now we have the AACN essentials, which are, you know, essentially all of the schools of nursing right now are looking at their curriculums as the new essentials have been pushed out. Yes, we are teaching to curricula. You know, there's conversation in the chat that curriculum has really been geared towards, you know, teaching to the test. But we know that clinical placements are hard, you know, across the country. Health systems are taxed at present, but we also know that policy is driving how care delivery is changing. So as we look at what's being funded nationally, where care is being provided, you know, we look at the CMS Center for Innovation. There is an initiative called Primary Care First. And it's really looking at how funding for higher acuity patients is really moving into the community. We're going to see more and more work and innovation happening in the community space. We're seeing innovations that are already emerging with startups as we're you know, looking at providing care where people are instead of where healthcare facilities are. And so I think there is a responsibility of our schools of nursing to start looking at those broader industry trends, to think about where placement opportunities are for nursing students moving forward. But I think that this is just, you know, we're just starting to see this, but especially with the new AACN essentials, I think this is a great time for those schools of nursing to be having those conversations and thinking about the future of the profession and where it's going, and what are those opportunities and skills that nurses are going to need. So other, again, I know we're almost, we only have a few minutes left and we didn't even get to all of the questions that we thought we might be able to get to, but, Julia and Shauna, when you think about, the work of nurses, why you have seen nursing at scale, both locally, nationally, globally. Why nursing, right? Why now? Why is the role of nursing so critical in this moment?
I mean, we're the Swiss Army knives of healthcare, of healthcare and human care and population care. We are just, I don't know if we start out as the type of people who make good nurses, and nursing just happens to be a little bit of everything: education, companionship, health, healthcare. I'm not sure, or if as nurses we become that, but that's just what nurses do. I hate to fall back on such a simple answer, but we're just so unique, and it doesn't get any simpler than that.
Mm-hmm.
I think you put it very well, Shauna. Nurses are amazing, and they're really like nurses need more recognition. They're, usually the underdog that is always doing usually most of the work and making things happen. And that's the truth, in my opinion. And so I think there's such a exciting future for nurses. And I think especially now during this pandemic, I don't know, I'm hopeful that things are going to get more exciting and there's going to be more doors. I really do hope that's true. So I just think that we're a strong group of people. We're smart, we're critical thinkers. That fine balance is rare between being with people in their most vulnerable moments and then being able to multitask and problem solve at that level. I think that's really, really a unique set of qualities that is often just not thought about as being so important, but it is. So I think go nurses.
One of the questions that they ask you in your EIS interview is, what if somebody asks you to do a task that you feel is beneath you? Because I guess, some people go in with this idea that they want to just perform these tasks and they don't want to do like medical chart abstraction or simple data analysis or something like that. And, you just have to stop and laugh as a nurse and be like, madam, sir, I can clean your poop off your butt, get your parent a cup of coffee, and then perform CPR on the neighbor all within a shift. Like there's nothing that is below me, above me. It is what it is. I am here to care.
It's completely true about nursing. And it's something I tell our kids, right? You're not more than or less than anyone, right? We're all here to just, navigate the world together. And, part of, both of you kind of leaned into this space, but, the hopes for the profession, be curious, as your takeaway, I think you've threaded some of that throughout the conversation, but also for all of the nurses who have joined the conversation, based on our conversation today, what will you continue to do or start doing or stop doing to promote innovation and the thinking that Julia and Shauna have shared in the areas that you're working? In the chat, what did you appreciate about tonight's conversation and discussion? Is there, how did the information influence your thinking or feeling about the topics that were discussed, or any commitment to action that you guys have through this conversation? Just curious, feel free to add it to the chat or to raise your hand. Question in the meantime, It's the spirit of inquiry that nurses have that makes us keep pushing. Great comment. Here to care. Julie and Shauna, while people are thinking about it, something that I really appreciate about the conversation is the fact that, you both of you had an incredible amount of courage and bravery to step into these unknown spaces, to the courage to continue to follow your path, to follow your interests, to not be pulled. You could have been pulled in any number of directions, but you kept coming back to what you were passionate about. With your recognizing that the EIS is right, a window of time where you're doing this work. What are you thinking about next when this experience is over?
Well, I myself would love to stay with CDC and see where the journey takes me. CDC is quite vast and there's a lot of branches and divisions doing really exciting work. So that feels very exciting to me. I will entertain the idea of getting a PhD maybe eventually, we'll see. And I definitely think that I'm hopeful my curiosity for learning is not going to fade. I think it's going to continue for my whole life. And that's my hope for myself.
Yeah, I think that was, what do I want to be when I grow up? If anything about my journey has taught me about my future, it's that I want to continue to be open to the opportunities that are presented to me. I'm part of the Global Rapid Response team within the CDC. So with that came an opportunity to apply for another certificate, Ori, if you can believe it, and this one in global health and sort of global health implementation and programs. And so I'll be starting that program later on this year. And we have another fellowship available that is only available to EIS officers called Flight, and that's Future Leaders in Global Health. I might entertain that, perhaps. Getting paid to continue to learn is my dream job. But I agree with Julia. I did not ever see myself working for the federal government, but I am really enjoying it. I am enjoying this culture of people who really care, and they are weird and they want to just help people. And they're also trying to be innovative and make do with what surprisingly little funding. You guys would be really surprised how little funding we actually have. But it's just a really neat place, and I'm enjoying it. And I think that it's similar to like nursing. You can work on a renal unit and then maybe go to med surg or maybe go to the ER. Here in CDC, I can be in waterborne disease, or I can go to chronic disease, or I can go to influenza. And so I'm really looking forward to the opportunities and seeing where helping takes me.
Well, and to know that, right, and by choosing this path, there are, the growth potential, that there isn't a ceiling in this space. It's simply, what you want to learn about now, right? And where do you want, where do you want to develop professionally? And I think that's inspiring too, is to know that those potential opportunities exist, and it's a choice, and having flexibility in that space, how nice that is, and that it's, but again, great comments in the chat. I agree, as we're looking at nursing's opportunities, we're leaning into this space. I just wanted to, maybe loop back to one comment that was in the chat. But both of you, through your global experiences, you talked about how much you have learned and been able to, that crossover, how, and, through those global experiences. And as we're looking at, how do we bring more diversity to these spaces? Any thoughts about, because this is something that we're looking at nationally as we look at health disparities, the social determinants of health. And we know that people who are, who are coming from areas that have been disadvantaged to receive education are more likely to go back to care for those communities. So just curious about your thoughts or work that's being done in the CDC around this area.
Personally, I can't speak to the work that like the Office of Minority Health and Equity is doing in this space. I know that Dr. Walensky has recently come out as saying that, she's dedicated within our agency into making sure that there's more equitable representation from our populations that we serve within our agency itself. But this isn't something that can change overnight, right? I mean, we have created this system of injustice and racism and redlining and, educational differences over the course of hundreds of years. We have such a long way to go before we can even scratch the surface of trying to make things equitable and trying to bring even close to enough people of all populations to represent in these spaces. One day at a time, and thinking again holistically. I don't think it's enough to be a representative of CDC or a nursing school and to, go to a certain high school and be like, you should be a nurse or you should join us. I think we need to think again about going further back. We need to think about where people are living, what education they have access to, the nutrition, just supportive systems, funding for libraries, roads, transportation, public transportation to get to these schools, the opportunity to access, these fellowships that we have, access to mentors to write these letters of recommendations that you need to get into these situations. Like, I certainly do not have the answer, but if I had a magic wand, it would be done. But I think it's a long road ahead.